Katherine in on the show. Katherine, great to have you with us to discuss the book and some of those startling revelations. To start off with, what really prompted you to go out there and investigate the generic drug industry? Why did you choose India as your investigation target?
I started investigating the whole issue of generic drug quality in 2008. About a decade ago, and I was contacted by a radio show host in the US named Joe Graydon, and he was receiving calls and emails from patients who were having all kinds of problems with side effects from generics. He brought their complaints to our regulators, the USFDA. They basically brushed him off and said, it's psychosomatic, it's in their heads. So he then contacted me. He knew my work as an investigative journalist. He suggested that I look into this question of what is wrong with the drugs. So I began to investigate, and I discovered really some issues with how our regulators oversee the quality of our drugs, because they do it somewhat on an honor system, getting data from companies and pre-announcing inspections overseas. But it was at the point that I was contacted by a whistleblower named $4 refill, which is the price of filling a prescription in the US. He suggested that I look at the overseas plants where the majority of our drugs are made. And it was from that pivot to really looking at overseas manufacturing that I first learned about the company called Ranbaxy, who, of course, all your listeners know that name very well.
Yes, we do. Katherine, now your book has revealed serious flaws in the way the generic drug industry has been functioning now for decades. What has shocked you the most in the course of your investigation?
So what's really shocked me the most is the extent and the depth of the fraud and falsification. I mean, the book exposes companies that are literally inventing data. They're just making it up. And in the case of Ranbaxy, it was taking brand name drugs and testing those drugs and passing them off as its own. So, as one source said to me, once you're willing to just invent hundreds and thousands of data points, what won't you do? Where is the bottom? And that really has shocked me. We have this idea that you run a pharmaceutical company because you care about the health of patients. But in this case, it is the race for profits that has really trumped the needs of patients.
That indeed is fairly disturbing. Katherine, there can't be a world without generic drugs. Is that affordable to a majority of the population? So what then is the middle path to follow? Because quality and pricing, they're both non-negotiable.
I mean, you're absolutely right. Generic drugs are essential to global public health. We need them. We can't do without them, but we need them to be of guaranteed quality. So how do we do that? I mean, first of all, we have to stop regulating these companies on an honor system. It is wonderful that they want to make these drugs affordable, but on the other hand, the quality has to be verified. And in order to do that, we absolutely must have regular, unannounced inspections and systematic surveillance testing of these drugs on the back end. The public health community, understandably, has been fighting for access to low-cost medicine for decades, and that's a very, very important fight. But they also need to understand that just because a company is willing to make those drugs and provide those drugs does not mean that they are also automatically guaranteeing the quality. That has to be verified by the world's regulators.
Would you place the blame then when it comes to quality woes? Is it solely large profit-seeking pharma majors that you mentioned, or a great, extent to the blame would be to the USFDA, the regulatory oversight that can't be ignored?
Unfortunately, there is a lot of blame to go around. So let me start with US regulators, our own. They have been doing pre-announced inspections in India and elsewhere overseas. So if you give a company, 6 to 8 weeks of advance notice that you are going to be arriving, everybody listening to this knows what companies are going to do. They're going to clean up, and in the words of my sources, they are going to stage inspections. So that does not give you a true look at quality inside a plant. And our regulators have been extraordinarily defensive in arguing and defending a system that clearly is broken and does not work. I would say that blame also lies with companies, and let's take Indian companies, which really have, in my investigation, many of them, not all of them obviously, put profits above patient safety and health. If they want to be part of the solution, they need to adhere to rigorous good manufacturing practices. And at the moment, they're basically trying to game the system by creating data that looks good and in many cases is too good to be true.
Indian pharma companies have claimed many a times that they are being targeted unfairly by the USFDA. Would you disregard this view totally, or would you agree that USFDA may be backed by outside influences to target the pharma companies?
I totally don't agree with that. I did not find any evidence of that in my reporting. To the contrary, what I found is that the USFDA is routinely going easy on Indian companies because they are so concerned about drug shortages, and we are so dependent on a uninterrupted supply of low-cost medicine. And let me give you an example of that. In my reporting, I found that over the course of about 6 years, from 2012 to 2018, our regulators downgraded recommended sanctions against Indian drug companies from its own investigators. So FDA inspectors are going into plants, they're finding egregious conditions, they're finding data fraud. They recommend the harsh penalties that are included in official action indicated designations. And FDA bureaucrats back in Maryland at FDA headquarters have downgraded those recommendations. So as opposed to being unfairly targeted, they are really inexplicably being let off the hook by our own regulators.
The same pharma companies are also supplying drugs to Indian patients, while the risk to the health of American consumer is well documented. What's at stake for the others?
Well, unfortunately, I think that Indian patients have it even worse, because one of the things that I uncovered in my reporting is that these big exporting generic drug companies are making different levels of quality for different markets. So essentially, the manufacturing standard is boiling down to whatever they can get away with. Unfortunately for Indian patients, Indian regulators have been so asleep on the job that Indian manufacturing companies feel free to make lower quality drugs for the Indian market. And I have a number of examples of that in my book, where they have basically just invented all the data for the Indian market because they don't feel compelled or concerned about the Indian regulators and whether they'll be taken to task for that.
So I know you touched upon it, Katherine, but which are the Indian companies in your investigation that are diligently following the USFDA norms, have been clean, and which are the ones that are still some time away from completely adhering to the USFDA norms?
It's sort of difficult to name names right off the cusp, but I would say that there are Indian companies where FDA investigators have not found data fraud. They have not found fabrications. Of course, no company is perfect, so there are lapses. But clearly, there are companies that are trying to do it right. On the other hand, there are companies that really investigators have found endemic fraud in numerous plants. Wockhardt has been one of them. Unfortunately, Dr. Reddy's has been another. The company Hospira has been another. IPCA has been another. So there are companies where it is evident that they lack the kind of controls that are required for good manufacturing and are taking all kinds of shortcuts that imperil patients.
So finally, Katherine, do you believe that majority of the remediation process post the USFDA inspections and observations have been completed and that the generic industry is now well on its way to being a good and a clean provider of effective medication?
I'd like to say that that's true, but I'm not sure that I can. I mean, what is clear from analyzing FDA data of inspections, which I have done at great length, is that the findings of data integrity violations are continuing. And they're rather high in India. In fact, about a quarter of the plants where FDA investigators have gone in and found problems, they are still finding data integrity violations. And I hope to release some of that data in short order. But the short answer is that despite the industry's claims that things are improving, I'm not sure that that is the case.
All right. Thanks so much then for joining in, Katherine. You've really brought up some very startling revelations, but we'll have to wait and see now how, this overall issue goes forward. But I believe that, the checks in place now by by the USFDA are becoming more stringent in nature.